Perhaps the most underrated and conveniently ignored part of the human body will be our mind. There's a lot of taboo and stigma when it comes to mental health around communities and across the world. Today, let's break that stigma. Today, we have renowned psychiatrist Dr. Girish with us. Welcome, Dr. Girish. Thanks for joining us. Doctor, as it's been 20 years in the psychiatric field and seeing a lot of patients, what sort of cases have you seen recently rising, and what's the age group like?
Well, so we've seen a lot of awareness about mental health, especially post-pandemic.
Okay.
I think it was the COVID-19 pandemic that got these conversations about mental health going. People were less ashamed of speaking about it because it was all of us going through it together. So I think that was the watershed point where people started speaking. I would say it was the silver lining to the cloud of the pandemic where people started speaking about mental health. So I don't know if it is more people having these problems now, or is it just more awareness and people are coming forward to speak about them. And it's the whole range of anxiety, depression, trauma and its impact, PTSD as we call it, to even psychotic disorders like schizophrenia or delusional disorders, substance use. ADHD is a thing that we see a lot now in adults. Of course, we always identified it as a childhood disorder, but now the number of adults that are coming forward, this is adults that have worked for 20 years and have had successful careers. But then now they think that they have ADHD and they come for an evaluation. I think what has changed in the recent years compared to before is, I don't think it's the incidence or prevalence of these disorders that have gone up, but it's the more awareness. That's one thing. Or maybe actually the incidence or prevalence could have gone up with the kind of a fast life that we live right now. And anything that becomes like a social trigger or a psychological trigger to someone that has a biological vulnerability to illness, there's a greater chance for those symptoms to start showing and becoming more clinical. With regards to age, no one is immune. We see all ages.
All ages.
All ages. Like everyone is equally affected. So it's not as if we see more in the teenagers or more in the working population or more in the elderly or in children. It's all ages. So if there is a rise in the number of people coming out with mental illnesses now, it's almost everyone.
Okay. And honestly, I've seen a lot of children's with multiple issues, anxiety. Do you think gadgets played an important role in it?
100%. With the amount of screen time, you sit down and do the intake of a child that's come to see you for the first time. You're speaking to the parent, of course, and you typically ask for this question, how much is the screen time? And the average that I get to hear is 6 hours, 7 hours. And out of this, the time dedicated to studying related use of screens, it's 1 hour or 2 hours at the max. Yeah. Despite all the logs, all the parental control, it goes up to 6 to 7 hours on average. And I think that's a big contributor to the kind of illnesses that we now see in children. Mental health illnesses is what I mean. So yeah, it definitely has a correlation.
Doctor, I want my patients to understand what are the signs or the first early signs of any sort of mental problems, either in themselves or for others.
I don't have a straightforward answer for this because it looks very different for different people. Even in anxiety could have some certain common characteristics that most people with anxiety would have, but it could be so differently manifested in different people that we can't kind of count 10 symptoms and say that these could be the hallmarks or these could be the pointers or signifiers of someone going through some sort of a mental illness. But at the subjective level, if you see that your level of functioning is changing, you're not as productive as you were, the enthusiasm, the energy that you had like you had before even if you're functioning, you're going to work every day. You are delivering what you expected to, but you see that you're not engaging as much. You're doing it because you have to finish. You don't feel a sense of passion or that sense of rush or that feeling of achievement from it. You know something's different. When you don't connect with people around you, people that you connected with, whether it's your family, whether it's your friends, or you don't find that joy or pleasure in the activities that you previously enjoyed. Right? So you know that something is different now. If you see your appetite changing, if you see your sleep habits changing, these could also be signals that maybe your mind is not in a good place.
And if you see, because I've seen a lot of patients as well with a lot of gut issues.
Correct.
And what do you really feel like, how gut and mental health is related?
Well, mind and body, they go hand in hand. So it's not as if it's a physical illness, it's a mental illness. If one is affected, the other would be affected. And going back to your previous question of what could be early signs of someone going through a mental illness, sometimes it's the body that starts telling you that your mind is not in a good place. So you have these headaches, backaches, gut issues. And when you go get a check done, the doctor says everything is okay. But talking about gut, more recently, there's more and more research that links the gut and the mind. Stress does impact how your gastrointestinal system is working. So we're looking into it, and we know there's something called an irritable bowel syndrome that's been established for years, where you go and you feel this bloating, uneasiness, you're not able to tolerate certain foods, your bowel habits are changing, you feel a discomfort that's not medically explainable. So you know that it's your mind not in a good place, and clearly that's affecting the functioning of your gut.
Doctor, I often hear from my patients that I want to seek a help, but my family is not agreeing. There is a disagreement, or do you think that there is still a stigma related to mental health? And do you think that an open conversation is really required here?
I would agree. I can't agree more, because it's like the elephant in the room. Everyone knows that there's a problem, but nobody wants to acknowledge it. Isn't it so strange that you can see it, but you don't want a family member to come out and speak about it in the open, because there's a fear of judgment. You're seen as weak, you're seen as vulnerable, you're not seen as not strong enough to help yourself, and giving in to the difficulty or the challenge that you have, you don't have enough coping skills. So that's how the general perception would be if you express your vulnerability. And nobody likes vulnerable individuals. Nobody wants to be seen as vulnerable and not being able to handle whatever challenges that they're going through. And I think that's where the shaming starts. It's seen as a sign of weakness. It's seen as a sign of, oh, you can't help yourself. You need to go see a doctor who'd help you. And I think the problem with mental health is, unlike physical health, which is measurable, which is visible, mental health is in a subjective space. So if you tell me I don't want to go to work today because my mood is not good, what do you think someone else looking at you, absolutely looking intact on the outside, expected to say to you? You look okay. These are just excuses. Why don't you just pick yourself up and go do it? And once you go, it'll be okay. Go meet friends, go do this, go for a holiday, and they think that this will resolve issues. So I think there's a lot of stigmatization related to mental health, seeing it as a character flaw or a sign of moral weakness, rather than seeing it as a disease or an illness. And that's why people are ashamed of seeking help.
Yes, like a heart, like kidney, or like any other organs in the body, sometimes brain also get tired.
For sure, it does. We can't see it. That's the problem.
You can't have an ultrasound scan.
You can't have a blood test that would show that your mind is not working.
Right. Many of my patients ask, like, Dr. Once I start the medication, will I need to take it for a very long time? Will I get addicted to it? How can you explain in simple way where our patients will understand about it?
Well, it depends on what their diagnosis is, but for most people with mild to moderate depression or anxiety, they would have to, if they're going on it for the first time, they would have to be on it for 6 to 12 months. We always have a plan to try and wean them off, and 50% of them would not need to go back on them ever again. So it's a myth that once on medication, always on medication. As I say this, I would also want to emphasize that some people have a more biological or genetic proneness to have either depression or anxiety. It runs in families like a lot of other physical health issues. So those are the people with a more biological causation to their problems. They are the ones that would probably need to have a biological remedy like medication for a long time. But we always decide on a case-to-case basis. And of course, if the problems are more psychological and social, we also try psychotherapy and similar approaches just to see if that is enough, especially in the mild to moderate cases. And for a lot of them, those changes, those approaches are enough so that they don't have to be on medication, or eventually they are able to get off medication.
Right. Doctor, why is it so important to seek help for any sort of mental issues rather than ignoring them?
One, if you don't address them, it's going to affect the quality of your life. If you don't feel that connect with life, that joy of living life, and what's the point of existence? Yeah, so clearly it's not just for that reason, not just for physical health, but we also know when you're chronically stressed or you're in a low mood all the time, even if you're functioning, even if you're fulfilling your obligations and duties for the day, taking care of your family, going to work, so on the outside you're fine. But if your mental health is not in a good place, 100% it would have a negative impact on your physical health.
Right.
Your immunity is going to go down. You're going to catch the flu or an infection here or there. Just because stress impacts your immunity negatively, it also increases your chances for chronic health issues, whether it's autoimmune diseases or anything else that we know. Stress is going to, if you have the propensity to have them, stress is going to precipitate them. And if you already have them, stress is going to make the
More
impact
severe.
of the treatment, it's going to make it more severe. Yeah, so that's also one reason for you to address your mental health issues, because it would have a very strong impact on your physical health.
Right, doctor. A good quality sleep is the first most important priority in our health, right? What's your suggestion? Like, many of our patients says that I don't have a good quality sleep, or I don't sleep well and I feel fatigued when I wake up in the morning. And what's your opinion, or do you have any tips for our patients, or should they really consider seeing a doctor?
Well, I think when it gets very chronic, that they've not been sleeping well for many weeks or many months, that's when they would seek professional help. But I think more or less the sleep problems that we see in most people now is a lifestyle issue. There's no discipline with sleeping time and waking up time. So a lot of it is just that. Once they set their lifestyle in order, once they're more disciplined with going to bed at the same time, waking up in the morning every day at the same time, that sets things right. Because if you sleep at different times and wake up at different times every day, you're playing with the biological clock.
Right.
So you're not programming the biological clock well. So once you start having a more discipline, more routine around your sleep-wake cycle, that sets things right mostly. A lot of other simple things that can be done. Make sure that the place that you sleep in is comfortable, with the light, with the mattress, with the pillow,
with the temperature,
with the ambience. So just make sure that it's a peaceful, it's a comfortable sleeping environment. That would help you with sleeping better. Something else that sleep hygiene practitioners would tell you is to not do anything else in the bed apart from sleeping. We eat our food in the bed. We scroll through our mobiles in the bed. We sometimes work in the bed. So detach all these activities from the bed. The bed is just meant for sleeping. So it's almost like conditioning yourself that as soon as you go to bed, it is for sleeping. So it's a simple thing that people can incorporate, and that makes sleeping better.
Doctor, can you suggest few tips for a good quality sleep?
I think first and foremost is having some discipline with your sleep-wake schedule, which means go to bed at the same time and wake up at the same time every day. Doesn't matter weekday, doesn't matter weekend. Don't make exceptions with this. Another important thing is to make sure that the sleeping environment is conducive for a good sleep, with the lighting, with the temperature, with the comfort of your mattresses and your pillows. So this is important. Avoid eating a heavy meal just before bedtime. Try and space 2 or 3 hours between your last meal and your going to bed time. avoid heavy exercise in the evening because it activates your brain, and so it makes sleeping difficult. If you have to work out, if it's a heavy one, try and do it in the early half of the day. Something very relevant to all of us is that we need to switch off from our screens, whether it's TV, whether it's your mobile, just because the light from the screen is going to activate the brain and is going to make sleeping more difficult.
Yeah.
So these are simple things that one can implement. Easy to
Yes.
understand, but
Yes.
I think the problem is with the implementation. But
Implementation, right.
I'm very sure if you're able to implement these simple things, a lot of your sleep problems would subside.
Thank you. So I want to know from you, is sleep the most important thing for anti-aging?
That's my anti-aging secret. It's out now. Everyone knows. I look younger than my age because I sleep well. No, jokes apart, sleep is vital. Sleep is imperative to good mental health and physical health. It's a biological necessity.
Yeah.
It's the time that the body needs for repair and for recharge.
Yeah.
So if you're not sleeping well, it's going to definitely have a negative impact on your mental health and your physical
Physical health, right.
No matter which illness you want to name, bad sleep is going to make it worse.
Right. 5 biohack to stay happy.
Okay, all right. Well, there's a way that you can hack your hormones, your happy hormones,
Yeah.
naturally, and it's not too difficult. We have the resources around them. You just need to go tap into them, and they give you that elevation of your mental health instantaneously, almost. So, serotonin is the happiness hormone. This is the hormone that is there in all the antidepressant pills that you're prescribed. How do you naturally boost the levels? Just go walk in the sun for half an hour in the morning. That's it. Connect to nature, connect to animals, and connect to trees and plants around you. That in itself would naturally make
Boost
your
the
serotonin levels would be enhanced, and that's a natural antidepressant. Why are you denying yourself of that
Okay.
of that easy privilege that you have? Dopamine is the chemical that gives you that sense of high, that sense of happiness, that immediate feel good that you have. All that you need to do is just celebrate the small wins around you. You don't need to have a big achievement to feel happy. Every small thing, even a small task that you finish, celebrate it, and that releases dopamine in a way that gives you a sense of feeling rewarded about not just that particular win, but about life. Endorphin is a natural painkiller. All you need to do is go work out, have your routine workout in the gym. You don't need to lift heavy weights. Just a bit of moving your body, and
Yeah.
that releases endorphins and saves you from taking those painkillers that you become so habituated to. And the last one, not the least though, is oxytocin. It's the love hormone.
Yeah.
All you need to do is hold someone's hand, go hug someone. That lets the oxytocin be released in your body, and it just heals you from whatever pain that you were going through emotionally and physically.
Simple,
Simple.
and the best way.
Absolutely.
What do you think is the most common myth in mental illness?
But there are several, but I think if you're asking me the most common, it is not seeing mental illnesses as real problems. What I want to emphasize is depression or anxiety in a more clinical sense is as real as diabetes is, or as real as any of the other cardiovascular problems are. So it's not as if you choose to be depressed or you choose to be anxious. It's like an illness that hits you, and you need to take the steps. You have to acknowledge that you have a problem. And just like if you have diabetes, you'd go check with a doctor and get it treated. Likewise, if you think that you have any of these problems, if you're not feeling your usual self, if you see yourself as consistently low in your mood and not as productive, not as connected, different from how you usually function or know yourself, you have to accept it. You have to get yourself checked. And if there's any treatment needed, get it done.
While stress is a part of our life, right? We cannot stay away from stress. Could you please let us know few tips or few recommendations how to manage stress?
Like you said, stress is inevitable, and everyone's stress looks very different. Yeah, so there's no one size that fits all. But if I have to speak from a more gentle space, things that help people is, number one is the ability to say no.
Yeah.
Draw the lines where you have to draw lines. Be assertive. Don't be impolite when you have to say no, but you have to take care of yourself
Right.
to help yourself not feel as stressed as you feel. Just be sure of the things that you can control and things that you cannot control. So don't try to control the uncontrollable. Yeah. A lot of stress comes from living in the past or worrying about the future. So try to live in the present moment. That's what you have. That's what you can focus on, and that takes a lot of stress out of your system. Avoid hot button topics. There's a lot of things happening around in the world, things happening in office, things happening at home. So anything that puts you into that space where you know you would feel triggered and would wire you up, try and avoid those topics if you can. Because if you cannot, you get into that space and you go through it, but avoid as much as you can. There's something called journaling. It's something that a lot of people are doing now. It's very therapeutic to sit down and write what makes you feel stressed, what your triggers are, what your response to stress is, what happens to your body when you're stressed. So it just helps you understand your patterns of what makes you stress and how do you usually cope with that stress, so that you can look into what are the repetitive patterns, what is not helpful, you can eliminate that, and what is gently serving you well, you can keep those things.
Right.
So journaling, as much as it sounds like, oh, what difference does it make to sit down and write what you're going through, but it's almost like a self-reflection. You can always refer to it and see what helped you and what did not. Avoid unhealthy coping strategies. Don't go for alcohol or smoking as a way to help yourself. Don't go into food for comfort, especially high caloric food. It helps you immediately, but it's just for a few minutes, and then you find yourself more stressed. So avoid all of these unhealthy coping strategies and you find yourself in a better place.
Perfect. Thank you so much.
My pleasure.